to you all, and welcome to those who are joining us on live stream. If you are not meant to be in this panel, which is on the demographic shifts and their implications, challenges and best practices of aging societies, now is your time to leave the pavilion, because that is what we are going to have the pleasure and the interest in discussing for the next 50 minutes. There will be time for questions, so we're going to start with our wonderful panelists initially, and then we will have about 20 minutes for questions. So do think about what questions you would like to ask the panelists. There will be a roving microphone. Please speak nice and clearly into it. But now let's get to the introductions for the panelists. I am going to be the moderator for today. My name is Professor Irene Tracey. I am currently the Vice-Chancellor at the University of Oxford. I am a neuroscientist by background, and I've spent best part of my academic career at the University of Oxford. And today we have an array of fantastic people drawn from different aspects of this very interesting area. So I'm going to very briefly introduce. So first of all, in the right-hand corner, we have Professor Melinda Mills, who is Director of the Leverhulme Centre for Demographic Science and Professor of Demography and Population Health back at the ranch at the University of Oxford with me. So welcome, Melinda. Next to her, we have Professor Elke Schäffner, who is the Deputy Director of the Institute of Public Health at Charité. Very warm welcome to yourself. We have Dr. Henry Marx, who is the Permanent Secretary for Higher Education and Research for the State of Berlin. Good morning, Henry, and welcome. And last but not least, we have Dr. Diana Rothe, who is the Head of Innovation and Service Robotics at Innovate Healthcare Company PI4 Robotics. And we have a treat for you momentarily in that regard regarding robotics. Now, I'm looking at the demographic in the room, and accepting one or two, I think there's a very clear reason why all of you have come to this session, is that we are all in the kill zone phase of life and facing the inevitable, which is that we're getting older. And so let's hear a little bit about how our individual panelists think themselves about aging and what it is and the meaning of that for them and how they're approaching it. So Melinda, why don't you kick us off?
Well, it's a bit disheartening to hear I'm in the kill zone of life, but thank you, Vice Chancellor, for those comforting words. Yeah, I think as a scientist, there's probably two things I do when I think about aging. The first one is study it. So we have an Einstein Center for Population Diversity here with the Berlin University Alliance, and some of my colleagues from Population Europe are here as well too. So we're looking at aging and bio and social factors related to that. And the second one is weightlifting. So I realized that women lose bone density in their life. So about a year ago, I started weightlifting, and I can now say I can deadlift 80 kilos, my friends.
Congratulations, that is impressive. Actually, the weightlifting is, for all those premenopausal women, it's really important to weightlift. We all think we should go running and all the gym, and that's good too. But actually, weightlifting, it's not too late if you're postmenopausal, but weightlifting is really important, actually, to keep that muscle mass and helps the biomechanics. So good tip. Okay, so this is going to be lots of top tips today. Thank you for that. Please, Elke.
Well, I think it's hard to escape the realization that we are all getting old. So I've been wearing glasses to read nowadays. I find that very disturbing. And I think if you're in your middle ages and you have kids and still parents, you are what I think the psychologists call the sandwich caretakers. So they're kids, they're all parents. And that is, for me, aging, right? Among other stuff.
Yeah. Thank you, Henry.
I hope this works. Well, thank you. Very good morning, everyone. I recently came to think very differently about aging. I always thought aging is a linear concept. Like every year put on another year. I found out ever since I took on this job, it's quite different. And I've been aging, I think, 10 times the speed in the last half year. And Melinda didn't help because the last time I tried to deadlift 80 kilos, I pulled a muscle. So now you made me really feel old. But again, I think this is not just a issue for you, but for all of us. I think that when you realize you're not in your 20s anymore, you cannot just go to work 12 hours, then go out with your friends and drink too much, and next morning get up and don't feel anything. But if you're in an age where you just feel all of these aspects without having done half of them, you feel that you're starting to age, and then it becomes about forming good habits, such as eating healthier, working out more, all those dull disciplinary things that make your life better in the long run. And I think I've certainly reached an age where I think about this a lot. I also try to implement some of these things, but also I've started thinking about them a lot.
Good tips. It's always very striking when you look at various politicians, notably presidents of companies, when they start and then when they finish their term, and they've gone grey, you know, within 2 years flat. It's extraordinary, isn't it? Diana, please, your own thoughts about aging.
Yeah, I often think about aging, and I have people in my family who need care because of their age, and I see how difficult it is to get this help. There are not enough nursing staff, and the existing ones, they are overloaded, right? I think I try to live healthy and save money for my age. But of course, I don't know. I know, of course, I know that's not preventing the challenges of aging. So, on that note, it's my aim, it's my vision to develop robots that can help, that can support older people to stay longer at their home and or be in caring environments where the nursing staff have enough time, because the robots do the routine work. Yeah.
Well, we'll get into that in a little bit, and maybe even see a demonstration. Well, thank you all for those sort of personal thoughts on your journey and approach to aging. You're all very clearly on the good side of the kill zone, so I think you've got a while yet before you need to worry. But Melinda, can I come to you and ask you just to maybe give us a flavour of some of the research you've been doing that's been looking at some of the societal environmental influences that affect aging, and some of the research that you've been doing?
Sure, yeah. So as a demographer and someone looks at biosocial aspects, we think about aging in terms of sort of the biology that individuals have, so your genetics, some of the things that I look at, and your set points in terms of biology. And you know that people have, you know, certain propensities to age, and they grow up in different environments. So for example, chronic stress and inflammation has been related to aging. That's been very important. But as well, you know, it's differential exposure as well, too. So what we see, and this is where we take the societal and the environmental factors, is aging is actually very unequally distributed. So how you're exposed to stress, how you're exposed to ultraviolet light for your job, or these different aspects. So we always have to think of these factors. And actually, we have an interesting European project, Map and Eke, where we look at and we map out environmental and societal exposures, actually down to 100 meters squared. So we look at things as what's your exposure to pollution, what's your exposure to you know, fine particulates, to light, to temperature, but what's your access to internet, what's your access to sports facilities, and all of these different factors. So it's not just your you know, biological aspects at age, but it's also the social environment. What are the labor market policies related to retirement age or remaining active in the labor market? Other factors such as you know, social aspects, and I know the Berlin University Alliance focuses a lot on social cohesion, and that's just key to understand aging. So loneliness is actually one of the factors that can really influence aging and how people age. So social cohesion is very important. And cohesion can you know, influence itself in terms of infrastructure, you know, looking at the politicians, or the infrastructure and the housing. So how are you able to get around? Do you have proper housing? What's your access to social care? So I think we often forget that it's these, you know, your biology, it's your family, it's your employment, but it's also, you know, the infrastructure around you as well, too. And I think we're in a really, you know, as a demographer, we're in a really interesting point in history right now, because we've just had dramatic increases in life expectancy. Not always healthy life expectancy, but we've had these huge increases in life expectancy. And so in 2019, the United Nations said that, you know, we have a life expectancy of around 72 years. It's going to go up to 77 years by 2050. we have this thing called the rise of the grandparent, the age of the grandparent, where, by 2050, 20% of the population is going to be grandparents. So this just changes things. And aging as well is quite concentrated. We shouldn't forget that it's concentrated in Europe, in North America, and East Asia. And we'll have some interesting geopolitical shifts and changes in democracy as well, too, because India is now the largest population in the world, so we have to rethink that. Yeah. So I guess just to conclude, think about biology and your weightlifting and all of these different factors. Think about staying active. We know that the COVID caused some cognitive decline, for example. We can actually see that lack of interaction is important. But also think about the infrastructure, think about housing, think about sports facilities, think about all of these different aspects. And I think that holistic approach will really take us farther when we think about aging in terms of our societies.
Thank you, Melinda. I mean, do you have an example either within a country or a particular country that would be sort of best in class that you would say you could look to at this point and has that right magic mix of ingredients that is allowing their society to age well?
Yeah, I mean, there's been a lot of different approaches to this. I think some countries are really struggling in terms of labor market shortages, in terms of thinking about how to change their retirement ages and employment ages. Others are instituting some really creative things, such as having care homes that are integrated into daycare centers.
Yeah.
To have that social cohesion, but also daycare and that interaction. Yeah. And other ones are just fundamentally rethinking the infrastructure in cities. How do people get around? How can these buildings be repurposed so that people can stay, within communities for a longer period of time? If we have labor shortages and we're unable to fill them, how do we deal with robotics? And I know we'll be hearing about that soon. So there's been many countries sort of working together, but it's really culturally, politically, and socially different. And I think there's not one size fits all.
Yeah, no, that's really important. Well, lots of thoughts going off, which we'll come back to. Elke, could you talk a little bit about how we've aged differently across generations? Because I think that would be, I think we tend to feel that we did it better back in the day, in times of yore. But is that true?
I think so, yes.
You just if you just speak a little closer for the live stream, thank you.
So I think the answer to that question can be given referring to an individual, but also to a societal level. So it's funny, if you look at the scientific literature of the past 40 years, you realize that age limits have moved further and further upwards of people who are called old. And so while literature of the 80s, for example, called someone old who was in his 50s, at some point this moved to 60, 65, and nowadays people below the age of 75 are basically still called young. So I'm always referring to someone I know who was 102 years old and called his 96-year-old friend a spring chicken, right? So it's all relative, and it's difficult to find a clear cut-off and say now you're old, right? I think we all agree, and you just said it, that age mean age has increased considerably and will still increase, and so are survival times, but it's difficult to find that clear cut-off. So for the individual, and you also started to mention that there is an increasing knowledge and body of evidence that we have cellular, molecular, and genetic mechanisms that help or contribute to prolong life and maybe even reverse aging. There's a big industry behind as well. So that will increase, certainly. And all this is motivated by our joint pursuit of longevity. And that brings me to the societal level, where we can observe that many people age really well. So they are very functional even in old age. We have pensioners going back to work if they are needed. We have octogenarians holding high political offices, as we know. And on the other hand, we have a huge fraction or proportion of old and very old people that suffer from at least one chronic medical condition.
many people even suffer from several or multiple chronic conditions, all that coming along with medical implications of, polypharmacy, that they have to swallow lots of medication, increased frailty, increased hospital admission rates, and increased healthcare costs, especially towards the end of life. And that brings me to the last point I would like to make, and this is the need for, from a clinical point of view, from my clinical judgment, the need for an age-adapted approach. So what I mean by that is that it does matter a lot where your patient is on his or her life course. So cut-offs, for example, or staging systems for diseases that may be true for a 40-year-old may not necessarily hold true for the 80-year-old. And that actually also holds true for special diagnostic tools, for my interpretation of results, but also for treatment goals and aims, and then treatment options. And the communication, or how do I speak to my patient, and how do I find out what he or she wants. So do we age differently? Yes, we do, definitely, on both on an individual and on a societal level.
Yeah, no, it's really, really very interesting. I'm going to skip Henry and go straight to Diana, if that's okay, and then we'll come back to you, Henry, maybe for some commentary on how you might see what Diana works on, which is robots helping us age better. Yeah. Can you tell us a little bit about your thoughts on that and your work, and just the challenges of developing a robot that people are going to be comfortable having around their home? And I think you're going to give us a little demo as well. Okay, so please, Diana.
Thank you. Yeah, everybody knows robots from the industry, right? Where they do monotonous and heavy work, but care robots are different from industrial robots, right? And the big challenge is the diversity of sites and tasks for such robots, and it makes a difference if a robot is in a care home, or it is in areas where mixed age people are living, and therefore it's very important to involve the users in the design process. That is a very important thing. And but it's also clear that a robot will never replace nursing staff, right? But will support them. And we saw in our research project that these helping tools are routine and service tasks, right? And these tasks save time and walking distance, and that is the focus of this robot we developed together with 3 of the viewer partners, right? And the second thing is that one big hurdle is the trust and the acceptance in such new robots. And we know today too little about these things. And we saw in our research project that human-like robots with a voice communication are preferred by people. And on the other side, the robot shouldn't be too cute, but friendly, have a friendly face and friendly communication. And yeah, RoMi is very curious, I think. So she's too cute, isn't she?
She's got a very nice smiley face. So please, Diana, tell us a little bit.
Guten Morgen. Möchten Sie etwas trinken? Bitte bedienen Sie sich an meinem Getränkefach auf der Rückseite. Prost, Sie sind aber durstig. Zum Wohl, lassen Sie sich die Erfrischung schmecken. Guten Morgen. Möchten Sie etwas trinken? Bitte bedienen Sie sich an meinem Getränkefach auf der Rückseite. Prost, lassen Sie sich die Erfrischung schmecken. Prost und einen angenehmen Tag.
Dankeschön.
Guten Morgen. Möchten Sie etwas trinken? Bitte bedienen Sie sich an meinem Getränkefach auf der Rückseite.
Okay, I don't speak German, so but it's obviously saying something very funny. No, that's,
Would you like a drink?
very Dankeschön. Super. So why did you decide to go on the service option as opposed to the
Guten Morgen.
companionship
Sie
option
sehen
and having
durstig
a
aus. Ich
conversation?
habe Getränke dabei. Bitte nehmen Sie sich etwas aus meinem Getränkefach auf der Rückseite.
Because we saw in our research project that that were the tasks which really save time,
unerwartetes
time for
Ereignis ist
caring of nursing staff.
So that was
the
where
right-
you got the data. It's interesting. Maybe we'll come back to this point in some of the other interventions we can do. I know that some of the more AI interactive language-based robots are being developed, particularly for doing some of the role playing for training physicians. So they are able to talk and learn how to give difficult news to a patient
course.
and have all that sort of interaction. And you could see how that could be extrapolated as a companion, particularly in the loneliness, which is obviously a key issue for being able to age well. So maybe we can come back to sort of where you see the robots advancing. But Henry, can I turn to you as a politician, obviously Secretary for Education, and the importance, obviously, of lifelong learning and all those aspects for our brain health. How do you, more generally, as a politician, think about in Berlin your interventions for being able to help your society age well?
Well, thank you very much for your question. I think basically your question has three layers. We have Berlin as a geographical area. We have the policies involving that research, or not more, a broader thing than research area, like a societal area. And you addressed me as a politician, so as an actor in that sphere. So that's basically three aspects of a question. First of all, I think a lot of the things Melinda said obviously also apply for Berlin. So that we have to think more about how we construct houses, how we build in elevators, not pushing the rent too high so people can still, especially if they're living off their pensions, still afford those, but can leave their homes. Not back in the day, we used to have still military service and social services in Germany. I was actually driving an ambulance, and I had lots of people who told me that hadn't left their apartment for 4 years because they just don't get down the stairs. So that trip to the dentist was their way out of the apartment. And I think this is something that we really need to change, just to have that social cohesion, to have people taking part in life. But that's more of the broader aspect. Then again, I'm not in charge of everything, luckily. It's enough with research and science and academia. And so we have to focus more on these. And I think in Berlin we have fantastic institutions working on these. Very apparent, as Frau Schäffner was a representative for the Charité. I mean, the Charité is one of the leading hospitals in Europe and the world. And we just talked about how amazing our institution is, how large it actually is. And that, I think, goes to show how important factor medicine, research, healthcare, the entire health industry is in Berlin as a factor, as of employment, of research, as an economic factor as well. So when we talk about policies, what I think my job is, or that of my colleagues, is to create frameworks for the brilliant people in this room and outside this room who do the research, who come up with new ideas, to help them build the framework for translational opportunities to get these new ideas into the homes of people, into the lives of people. That is something, I'm very glad I don't have to do this because you're much more brighter and smarter than I am, so you come up with the great ideas, and my job is to help you find the conditions to do this. So basically it's a lot about fighting for more funding, or at least trying not to get your funding cut. This is probably more what we're talking about in this generation, framework, all these things. So this is the geographical aspect, this is the policy aspect. Now, me as a politician, all these things I said above, but also one thing, I always find it's quite striking that we all know that we live in a rapidly aging society, yet we hardly ever talk about it. We talk about it in the aspect of labor shortage, we talk about it in the problem we don't have enough people in care, But we hardly ever talk about it, what a huge strain this is going to put on our social insurance systems, on growth, all these things, but also on a less economic point of view, the bright side of it. I mean, if you think about it, Germany is one of the first countries who introduced insurance for the pension insurance, retirement insurance. But back in the day, in the 19th century, it was designed for people to work, and then maybe live a year or two, and then die. This has quite changed, and that is also an opportunity that if we manage to find ways to keep people healthy, to have that social cohesion, that we can create a society where large parts of our lives you've achieved a lot, you've worked, but now you have 10, 20, 25 healthy years of just taking part. So that is also, I think, a more optimistic view, but both are important, the dangers, the perils within it, but also the opportunities in here. So I think as a politician, or anyone in the public sphere, it is important that we address this problem much more, and we talk about them, we face those challenges, yet it doesn't seem to be a very popular topic.
Yeah, it's interesting to ponder why we don't talk about it. I mean, there's probably just a general discomfort with facing the fact that we do age, and because there's been always, as you say, that historical narrative in our grandparents or great-grandparents that you retire then die quite quickly, there's a fear aspect to it. So Henry, how well do you think we communicate between countries, notwithstanding Brexit, let's not go there, but say with Britain, obviously, Melinda, you know a lot and you work with the government in the UK and other governments. How well do, we might not as a society discuss it, but are there moves for governments to share good practice and awareness of line of sight about what you're doing? Is that working well, or are there opportunities there for us to learn from each other? Say, let's take the UK and Germany.
Of course, there's always opportunities to learn between different approaches, whether it be, the UK and Germany or other countries facing completely different problems. I mean, you really addressed that this is really a European, especially Northern European issue, an Eastern Asian issue, and a part of the developed rich world. There is lots of opportunities how to learn better our systems, and even within Europe, quite strikingly. And then if you talk about in other countries such as Japan or China or other aging societies, that is quite different. And I think also what's important is that you kind of have to see that I think there UK and Germany are actually quite alike. If you think about even southern countries where family is still such a much more integrated institution in society, that it's much more common for grandparents to at least maybe not live in the same house, but at least see their kids and their grandkids every Sunday for lunch or something like that. That is quite a different approach. So I think it is both interesting to have that exchange with countries that have very different conditions, also with those that are like. I think there are these consultations happening. I think us here on this panel is a good example of these things happening, but there can never be enough of them.
Melinda, do you want to comment?
Yeah, I think it's really important, and that's why I'm so pleased that the UK is back into Horizon Europe and into these funding. Yes, we can clap. Trust me. For us, it's key. It's really key, and I think it's key both ways as well too, because we have, if we want to share practices, we have a lot of these international European projects, and it's really important. So we have one now looking at inequalities across the life course, and I mean, we have it across 8 different countries, and then you learn the policies, you learn the aspects about, there's some things that are very different in different societies for cultural, political, historical reasons. So you have retirement ages and working conditions and social care. But I think you brought up a really key point. Actually, a few of you brought it out about intergenerational support as well too, and and having that happen. So families supporting each other, but also if that's not there because we have people that have moved due to migration or labor or needs to move, how can you create a social network that sort of replicates these kind of intergenerational networks and has cohesion. But in terms of learning from each other, I mean, at least during COVID, it was surprisingly it was interesting, the lack of international comparisons sometimes. It was almost breathtaking. And I think aging, we're doing a little bit better about that, but, just not looking over the border. Okay, well, these East Asian countries experienced H1N1, so, they're probably have a good idea about what to do, but the surprising lack of comparison is interesting, and I really think we can learn best practices.
Oh, I couldn't agree more. I think the arrogance and the lack of humility that was displayed, not learning from, exactly. Please, Elke, you must have a lot to comment on this.
Yes, thank you. I think it was you who mentioned that aging is not very, very popular. And the question is, why is that? And probably because after aging, death will come. So inevitably, and if we, and I don't want to lower the spirit exactly, but I don't think we have to lower the spirit. The question was, how can we learn from each other? And I think where there is a huge difference between the UK and Germany, is that the talking about end of life, and from a physician's point of view, talking about end of life care. So how do we want to create this situation? Is rather a taboo in Germany, and so our approach is a lot different. We have our approach mainly is to prolong life as as far as it gets somehow. And this is, I think, I don't want to overgeneralize, but I think this is different in the UK, and I see that as something very positive. So I think here we can learn a lot from you, basically, to talk about these things, we call it advanced care planning, to talk about it early, and to seek to find out more what the patient really wants in the end, because we just spend millions at the end of life in probably unnecessary treatments. I could give a lot of examples. I don't want to overstretch your time, but where I come from nephrology, so I'm a kidney doctor. We dialyze people in their 80s and 90s, and I'm not saying there should be a cutoff. I'm not saying that at all. I know there used to be one in the UK, 65. So that's probably not what we want, but we want personalized treatment for the individual and see what's best for him or her.
No, you're so right. It's about the sort of aging well, isn't it? And then having that personalised approach to it, and a sense of control and autonomy that you get to decide how you want to age well. I love the idea of the care home with the daycare. I mean, that's such a simple intervention, but the win-wins are huge, because it's, we're really missing out, I think, for our young people to be close, particularly when families are not so close together, and having that normality of being with grandparents or older people. That's not as common as it was, say, in my parents' generation. So to have that, access to people of a different generation for the young people, huge wins there. And of course, that great joy that children bring for old people, that's such a wonderful, simple intervention. Okay, well, I'm going to open it up now to the audience. We have a roving microphone. Please just put up your hand and maybe just say who you are, and then we can, and if you have a particular question for a panelist, just direct it to that. If not, they'll put their hands up and feel who can answer it best. So over to the audience now for any questions that you might have. We have one here, and then one over with David.
Thank you, Irene. I thought I'd just get things going. I'm David Gamm from Oxford University. I'm a complete amateur in this area, except I'm getting old. And sometimes feel it and sometimes feel like a spring chicken. I have a question, which I've really enjoyed listening to this, which is a bit more of a global question about who else is working on this in a way that's really useful and interesting. Now, for various reasons, 30 years ago, I was working in Japan on smart homes. And I remember a thing called a Tamagotchi pet, which was a little cuddly toy, which used to sit in next to the old person and remind them to take their pill. So I'm thinking, actually, about your nice robot. And how do we learn more globally? And, Japan, we know, has had a big problem with an aging population and not enough care workers. And so robotizing the problem has been one of their solutions. Has it worked?
Great question. Who'd like to pick up on that one? On the robots, and then maybe more generally.
Okay. Yes, I think I was in Japan in April, and I saw the economy there, and I think it can work, of course, to support, not to replace. And I think robots will be a part of our aging, I think. And I think it's very important to design such robots that, they can support us, right? In every industrial country, it is needed to use new technique and, of course, robots that are safe, and we can be part of this. So,
and I guess sort of more broadly, I mean, Melinda or Elke, do you know whether those particular examples, say from Japan, have been effective in improving the quality of the aging population?
Yeah, I think it's interesting because you have this human reaction, and I think we shouldn't. Sometimes technologies are seen as a silver bullet to get introduced, but we know from self-driving cars, or other things that people are nervous sometimes around things, and as you were saying, can't be too cute or too personable. And I don't know if anyone remembered Furbies. I have to admit that the batteries accidentally came out of one of my children's Furbies at one point. The things would interact and they would cry, and I think they took it a little bit too far in the original versions, because they would die if you didn't feed them, which I found particularly cruel. So they were still honing that robot for interaction. But so I think we shouldn't forget the social element of people understanding and integrating these things. And they can't always be a silver bullet as well, too. So we have to think about, and I think, it was raised before about the labor market. And, so why, can we reskill workers? So we have this move to the green economy, digital economy. So can we reskill workers that were previously involved in fossil fuels or under other industries? Will be, think about construction. It's not just these high-skilled jobs, but construction jobs for refitting buildings to make them more insulated, and all of these different factors. So I think we have to sort of rethink that. And then there's been a shift. COVID had some bad things, but it also made us rethink work and the location of work and where we can physically work. So we can actually have, at least for some of the service economy, remote working. So I think it is, I always come back to the big picture. And I think that's where we have to link technology to labor market, to, what are our needs in that population, and project it out quite a few years as well, too.
I mean, do you see, and maybe Elke, you can comment, you've got a couple of approaches. One, I know that in Britain and around Oxfordshire, some of our physicians have been very keen to create a sort of elderly village that's a one-stop shop. It's got everything there so that you can age well. It's got all the companionship with some social activities, physical, health, and then the hospital treatments that you would need is there, so you don't have to come all the way into the city. It's not been created yet, and they're still trying to fundraise to do it, but the concept is an interesting one. I wonder myself, would I want to live there when I reach sort of 70? But their approach is a pragmatic one, is it's going to be easier to build it from scratch than to try and change a city and put in all the infrastructure and the needs. And I just wonder, again, maybe in Germany, what's the thinking around how you plan for an elderly population that does need to have all these infrastructure solutions? Is it just going to be easier to develop communities with it all in and just let them evolve, as opposed to trying to do it within the city?
We definitely need more creative ideas. I totally agree, and the factor of loneliness is such a key one. We have this cohort of elderly people we have been following for a decade, and so you had to be 70 years to participate, and the mean age was 80 at baseline, so very old people. And I think many of them also came back over 10 years, every second year, because they felt lonely, and they just loved it to talk to someone, which made us feeling ashamed somehow. But to come back to your question, I read an article in the German journal called Spiegel lately, and they described a great concept in the southwest of Germany, where they had basically a nursing home where the inhabitants, who were still kind of fit, greatly participated. So they were folding towels and the linen. They were actually deciding what they wanted to eat. So they were helping preparing the meals and also taking care of other inhabitants who were not as fit anymore. And I think we all understand that if you participate, you identify, and you feel better. Yeah. So I think the level of satisfaction and happiness was a lot greater. There's no randomized study on that, but I can imagine. And what people living there told the interviewer was that they actually liked to live there. So I think we need more of that. I'm turning to you now. We need more of that, more of out-of-the-box and creative thinking, if it's a village or if it's such a nursing home.
Yeah, no, absolutely. I mean, I think it's just such a human trait, isn't it? It's an animal trait. We are, animals, to have a sense of purpose. And I think that's a very common complaint that elderly people feel, is that they've lost their sense of purpose and they feel that their utility has gone. And that's really tragic. Exactly. And and we need it. So it's a great waste of resource that we're facing. Okay, I think the gentleman over here had a question, please. Thank you.
Good morning. My name is Dietrich Nelle. I'm innovation consultant and, as you can see, at retirement age. So I have a question on data availability and data use. Henry Marx was explaining the difference of perceptions we have in Germany and on the other side of the channel, and other speakers had been commenting on that too. And I'm wondering whether there could be a link to the data question. In UK, you have NHS, you have wonderful data, and maybe that's an explanation why it is much more easy to elaborate differentiated approaches for care, for healthcare, medicine, and so on, and also for public debate and public awareness of the different problems and opportunities related to that. So I'm wondering whether you share that impression, and talking again to Henry Marx as an actor, what are your ideas about improving the situation for using data in Germany?
That's a wonderful question. I think all panelists will probably have a comment to make in that regard. And just maybe to flesh it out, you're absolutely right. We do have fantastic data. We've also got these extraordinary cohort data sets. UK Biobank is another one, which again, all publicly available platforms, which very much speak to things that we need to learn probably quite early in terms of how that develops resilience or vulnerability in, three main organs: the brain, the heart, and the liver, and how that might also contribute to how you age well. And we're still just starting to gather more awareness of just how some of these influences about your educational, your physical activity, your nutritional status from birth, through to adulthood might set you up for aging well or not. And so again, these data sets are incredibly rich. Melinda, do you want to comment on sort of, again, the NHS data sets and the ease or non-ease of getting access to it?
Yeah, so it's almost like I would have planted this question. I love data, and I like talking about it and complaining about it and loving it. So yeah, so we've got some exciting things in the UK. So I'm on the Scientific Advisory Committee for Our Future Health. That's a new 5 million cohort that's collecting data, biological data, blood samples, and multiple measurements and questionnaires, and hopefully linking it to the NHS, the health records, but also some administrative records. And I think these kind of large data resources are really important to understand entire populations. So we are already able, as demographers, to analyze things in Scandinavia, for example, and in the Netherlands, where you have whole population data deeply linked to administrative records. Now, every country could do that, actually, but they just have to, the government departments, poor man. The government departments just have to speak with each other. They have different systems. The ministers have different levels of risk aversion. But you could do that, and you can actually, with some of the really exciting things in terms of neural networks and AI and some of the things that we can do with this data, you can analyze people using their records and administrative data in some countries, particularly in Germany, from birth to death, and you could actually predict to prevent. So you can move from talking about disease to talking about health. So data is just key, and I could go on forever, but I will pass it on.
You really struck a chord with that question. Elke, then Henry, please.
Thank you. Yes. There is something that is called Europäische Datenschutzgrundverordnung. It's probably the same in European data protection regulation. It's a killing word, and if something makes me age, that's it. So, yeah. So I don't know if this still holds true for UK after the Brexit. If not, there is one thing the Brexit is good for. So now, joking aside, it's really something that costs so much time and administrative work and keeps us from actually doing the research. So I don't want to do some, this Germany bashing now, but of course we have a lot of data. We have our cohorts and we have a lot more data, but we cannot access them and we cannot link them. And so there is a lot to do. And the interesting thing is maybe this last thing, this European data protection regulation holds true for all European countries, but the interpretation of it seems to be very differently. So there is a lot of room of interpretation.
I think, well, you heard the response from the audience. I mean, it is suffocating. Apparently, we're going to be developing our own version of it, which fills me with, I go cold at the very idea of it. So we're not fully out of that. Henry, defend yourself.
Well, first I will defend Berlin, Germany, myself, everything else. Well, first of all, you address a very striking problem, but I do want to mention that there is a lot of research happening in Germany and Berlin. We have the Berlin University Alliance that had its first grand challenges in questions of global health, addressing the very subject we talk about here. We have the BHI in Berlin, so there are a lot of things happening. A great research is being done, albeit we have that problem. So I'm not going to deny that problem. I personally think that, the other death you just mentioned, the protection data Grundverordnung, and you also mentioned, I think the striking thing is that you have that law in all countries of the European Union, but I don't think there's one single country that makes out of this that catastrophe that we Germans do. And I don't, now I'm German bashing now, but but the thing is, this is something that we really need to change. We see that we are lagging behind, we're falling behind, not just in research. I used to work in education, it's the same thing there. You have Scandinavian countries that have absolutely no problem with collecting data on the development of their students, on their academic performances, on social problems that they might, or opportunities that they might have, and collecting them in anonymous form, but giving a feedback to teachers to make them more aware of what's happening. So that's basically the same problem that you have with research. You need data. I know there are some initiatives in the German Bundestag and the German Federal Parliament to at least create for some parts of like a Forschungsdaten, so it's like a sort of a exclusive area where we might take things a little differently. This is something that I personally put my hope on, and I really think we have to push forward this. But in the end, why are Germans so obsessed with data protection? And I think in the end it is fear, and fear results from the lack of knowledge. And I think the problem is, and sorry, I'm not going to end on an optimistic note, I think aging society might not help with knowledge about technology, the internet, all these things. I just spent the weekend trying to explain my mom's computer. It took some time. But there's hope. I mean, she now knows how to learn the internet, so she'll never get the internet. There's hope. But the thing is, in the end, I think why Germans are so keen on that is a fear of understanding, what will happen with my data? Because many of them don't understand or again, why do people feel we need that protection? Because many of them obviously don't know the dangers that exist. I mean, this is not all made up. I mean, there is a problem with companies and unregulated things of collecting data about your personal life. This is nothing that I think we should take lightly. However, our answer must not be something that prohibits research, educational advances. We have to form different approaches. We have to rethink this, and we can learn there a lot from any country. You can just close your eyes and put it on the map, and you can probably learn from that country. And this is something that I think we should take on as a challenge here in Germany in general, and something where we definitely need to change fundamentally.
Well, that's a real statement there, and I think you've got a very listening audience that I think chimes with that view there. And I don't think this sort of rise of AI and the scraping of data is going to help that fear aspect for people. It's probably going to make it worse. But it is the case that there's such inconsistency in people's logic, because whilst they're terrified, like your mother, they'll meanwhile just put their credit card on any website when they're buying stuff on Amazon. So we're very inconsistent in our logic. But it does sound like Germany's ripe and ready for some changes, and we'll share our learnings as to how we develop a light touch GDPR. I hope we don't, but that is the talk at the moment. Diana, do you have anything to say about data that you want to add from the robots and development side.
Yeah, from the point of robots, we also need data. The very important functions like person recognition. It's a conflict. It's of data protection, right? So when we think about robots in aging, then we need these data for AI, for person recognition or speech. Yeah. So we will need these data. Yeah.
No, absolutely. I've been told we've got time. Can we take one more question? Yes, fantastic. Okay, I'm going to take two. Is that okay? 2 brief questions and 2 brief answers. Okay, Chaz, and then the gentleman at the front, and then we'll finish.
Can I ask the panel, do you think we look upon aging as a problem as opposed to an opportunity?
Yes.
You know, I'm slightly concerned that, you know, I know many people today who are 70, 80, 90, and they have found themselves a purpose, going back to Irene's comment about purpose and utility, and they are making themselves useful. And many of us here are going to live to 80, 90, 100 plus, and when we're at that stage, we're also going to want to feel as if we're useful and we have a purpose, etc. So, and even the title of this session, it's Challenges of Aging Societies. I do wonder that if we could turn the narrative to what are the opportunities and what could we do at that age to sort of help? Because I think it's a great success that people are living longer, you know, policy, science, technology, etc., etc. It's to be applauded, but maybe we could just change the narrative a bit.
Great point. Opportunities and best practices at Asian societies. Henry.
I think you're absolutely right. Age is a derogative term, or aging. And that is strange. There hasn't, I mean, I used to be a historian, so sorry for coming up with things that happened 300 years ago, but it didn't used to be like that. And I mean, we have this idea, you have to look young, you have to look fit, and you have to be healthy and all these kind of things. Okay, maybe being healthy is not so bad, but you know what I'm trying to get at. And so yeah, I think we have to turn the narrative around, to saying that certainly we face challenges. We shouldn't ignore those. But I tried to make that point earlier. I mean, this could be a fantastic thing if we think about it, if I take care of myself, and that is the idea of staying healthy, prevention, deadlifting, all these things. If we teach people more that people who are now 20, 30, if you take care of yourself, and if you're a little bit lucky, you might have 20, 30 years of your life where you do not have to go to work every day, but you still can do amazing things, find hobbies, take care of other people, do this, do that, whatever, but you have a large part of your life where you're not going to, sorry to say that, rot away somewhere hidden away and from public sight, but be an active part of society. I mean, that is quite a thrilling promise, isn't it? So yes, I think in order to talk more about demographic change and aging society, we need to address the challenges, but we also have to talk about it and what is positive about it. Because nobody wants to hear just about death and everything going to chaos. I mean, there's a reason we don't turn away from religion. So,
I've been told that we are at the end of time, so apologies, but maybe you could grab the panelists afterwards for your question. So having started with the sort of fact we're all entering the kill zone, let me end with a more positive note, which is rather than aging, I do think we should talk about maturing like a good wine. And so let us mature well, all of us. I hope that you feel like I have, that we've learnt a few things about what's happening, the wonderful research that our panelists are involved with, and the work that they're trying to do at a political level to make sure that we can share data, we can learn from each other, and that we can all mature well and live a good, purposeful elderly life. So good luck to you all as you enter that zone. And can we all please give a round of applause for our wonderful panelists, to Melinda, to Elke, to Henry, and to Diana. Thank you.